Most doctors have at least some idea that they should be actually listening to their patient when doing an exam rather than just pushing treatment. But there is actually a lot more to this than meets the eye. The use of too much dental terminology, sounding rushed, presenting too much at one time, and even your body positioning can all be detrimental to your case acceptance from patients. So let's dive right in. There are actually 3 sides to this: listening to your patient, the exam, and the actual treatment plan presentation. And each should be handled very differently. What I suggest about exams may surprise you. The first part of every exam should start with you just listening to your patients. Many doctors completely forget about this part because they're too busy and they feel rushed and they don't want to get locked into a 20-minute conversation about the patient's life. We have all had that patient. But this is actually the most important part of your exam. Why? Because it doesn't matter what you find or how you present it if your patient doesn't feel like you care about them. Plain and simple. No, but seriously, studies have shown that patients return to dental offices and become lifelong patients and refer their friends because of one reason over all others, and that is that they felt cared for by the doctor and dental team. And the way you make them feel cared for when you only have 5 minutes is by listening. So start out your exam first with something personal. If it's a new patient, ask them if they live close by or where they're from, or ask how their day's going. Something to first show them that you are human before you're a doctor. And then second, your assistant or hygienist should have already preheated you with why they're here today or what their chief complaint is, so you can now repeat that back to them and let them know that you are going to look at all the teeth, but will be focusing on that area that is bothering them. In this first few minutes, you are talking about their reason for being there. You should be actively listening and trying to get a feel for this person and how much they care about their teeth, how motivated they are, if finances are an issue for them, etc., etc. So you can do this by noticing how long it's been since they were last in, if they seem worried about their teeth, how worried they seem, if they bring up money at all, if they talk about how busy they are. All these things are usually things that patients will bring up, and you can be actively listening to customize your treatment plan to them specifically. For example, if your patient says something like, "Yeah, I came in because my tooth is broken and it's not really bothering me, but I'm already missing a lot of teeth and I use that one to chew. And I'm 75 and I'm not trying to win any beauty contests, but I do need something to chew with on that side, as long as it doesn't cost too much." If you were actively listening, you just received so much good information right there. You know your patient is concerned with finances and doesn't want a ton of cosmetic treatment, just wants to be able to function and chew. If you weren't listening, you may see 4 of their teeth that have huge amalgams and number 12 and number 19 are missing, and you plan 4 crowns and 2 implants, and your patient's treatment is $18,000, and you're thinking, this is definitely the best treatment possible, and your patient is in good hands. But what your patient is feeling is that you didn't listen to him at all and that you don't care about anything he just said. And he's going to go get a second opinion and see if he can get a cheaper price because he doesn't have $18,000, and obviously you're just after his money. If you were listening, your presentation would sound something like this. "Mr. Jones, we're going to focus on getting your broken tooth fixed. The only way to do that is to upgrade it to a crown. It had a huge old silver filling in it, and that's why it broke. I would also like to get you back some more chewing surface by making you something for those spaces where you're missing teeth. Since finances are a concern for you, the least expensive way to do that is a flipper or partial denture. This is not as permanent of a solution as an implant or a bridge, but it's the least expensive. If you'd like a more permanent option with a bridge or an implant, we can talk more about that. There are also a few other teeth that have the same old, large silver fillings in them and are at risk for breaking the same way this one did. I would like to upgrade those to crowns in the future so that they don't break on you as well, but we'll focus on your main concern first. Just keep in mind that those teeth are at risk." You're showing your patient that you listen to him, you know finances are a concern, you're not trying to push too much on him, and you care about the future health of his teeth without making him feel overwhelmed all at once. It's likely that since he feels cared for, he's going to trust your recommendations, and he will now try harder to find a more permanent solution for his teeth and come back and tell his family and friends that you listened to him and that you felt cared for without feeling pushed into a ton of treatment. And then after he comes back and you've built a little bit more trust, then maybe you can start talking to him about other treatment that he needs as well that wasn't quite as important. Okay, so terminology when presenting treatment. You want to achieve understanding on the part of the patient. You want the patient to understand exactly what they need, why they need it, and the importance of getting it done soon. Real understanding on the part of the patient leads to case acceptance. So when you use terminology that the patient doesn't understand, they stop listening to you and stop caring about what you're saying as much. They also start to feel like they're on a different level than you, which makes it harder for them to accept treatment as well. If you were to watch the patient closely, you could probably actually see the exact moment where they go blank and stop listening to what you're telling them. Some patients will tell you they don't understand, but many patients will just stay quiet and decide that whatever you are saying must not be that important. Otherwise, you would be saying it in a more understandable way. This is very simple to change and can make a huge deal. Just alter your wording to make sense to the average person. You may already do this to some degree, but you likely need to take it one step further. So think about explaining it in a way that you would explain it to a child, but with respect to their age. Working every day in this industry for years, we can forget how uneducated the average person is on the subject of teeth and dentistry. So here are some examples. Lingual, instead say tongue side. Periodontal disease, instead say infection in the gums and bone around your teeth. Periapical radiolucency, instead say infection in the bone. When you do this, you not only get your patient to have a deeper understanding and care more about what you're saying, but you convey urgency as well. Okay, so during the exam. During exams, you should have a very different approach. You really don't want to use any dental terminology at all that the patient could understand, which may seem difficult because most patients know the words root canal, filling, and crown. So you may be thinking, why? Because you don't want the patient worrying about the treatment he or she might need before you've had the chance to sit up, look them in the eye, and explain what they need and why. If the patient hears the words root canal or crown or extraction during the exam, there's a good chance that they're going to start thinking, oh my God, that's a lot of stuff I need done. I can't afford all that. Or, oh my God, did he really just say root canal? My mom had a root canal and she said it was so painful. I'm not gonna do that. So save all that for the case presentation when you actually speak to them and tell them what is going on and why they need all these things. I promise you they will be listening much better without all the self-talk and anxiety rolling around in their head. Unfortunately, I've seen plenty of cases where the doctor did this during the exam, then sat the patient up to explain, and the patient already had one foot out the door. As soon as the doctor starts trying to explain, the patient's already saying things like, I don't want a root canal, or I can't afford a crown, and bam, you have lost them. The way to handle this is before you start the exam, explain to the patient, Mr. Johnson, I'm going to check all your teeth with a focus on your main concern. My assistant and I are going to use abbreviations for terms that you probably won't understand. This makes the exam go a lot quicker, and I promise before we do any treatment, I will explain everything to you. You will know all of your options and how much it'll cost. And then you just use abbreviated codes that only you and your assistant know, like RTC instead of root canal, PFM for crown, EXT for extraction, OS for consult with an oral surgeon, MOD for a filling, or SRP for periodontal therapy and deep cleanings, BR for bridge, IM for implant, and so on and so forth. And then when the exam is done and you're doing your case presentation, you can explain everything to them and they have their full attention on you and the importance of what they need done, rather than worrying about how scary it could be or how much it will cost. Also, remember, if their case is very large and complex, you can always ask them to come back for a consult or treatment plan workup. You don't want to spend 20 minutes in an exam explaining everything. And it's reasonable to say to them, sir or miss, your case is complex and I want to make sure I give it the appropriate amount of time and thought before presenting it to you. And I want to give you enough time to answer all your questions. And then find a 30-minute or 20-minute slot for them to come back another day. I guarantee you will double your case acceptance rate as well as your patient referral rate if you put these practices into place. And to learn how to double your revenue like our current clients are, you can go to mintyfreshmedia.org or click the link in the description below and apply to work with us for 30 days for $1 and receive a report of the results at the end. No contracts, cancel at any time. Thanks for tuning in with Minty Fresh Media, and we'll see you next time.